Welcome to our presentation on exercise and osteoporosis based on the 2023 Osteoporosis Canada guidelines. To help frame our presentation, we will discuss Mira's story, which is similar to that of many patients we see in clinic. Mira is a 65-year-old woman who was diagnosed with osteoporosis from a recent bone mineral density test that was ordered by her family physician, given that her mother had a hip fracture. She was previously very active and is wondering what exercises can help manage her condition. If you have been diagnosed with osteoporosis or are looking for ways to help manage osteoporosis through exercise, then this presentation is for you. Here's an overview of the topics that we'll discuss today. We'll start with a brief introduction, then progress to the Canadian 24-hour movement guidelines, talk about the impact of exercise, which exact exercises you should do, and then end with some good practice statements and some conclusions. We plan to highlight why gait, balance, coordination, and functional training are not just recommended, but essential in the management of osteoporosis. Organizations like Osteoporosis Canada recognize the significance of exercise for postmenopausal women and men aged 50 years and older. They've established clear guidelines aimed at preventing fractures and preserving bone strength through targeted physical activity. People with more severe osteoporosis or at high risk of fractures may need to modify their activities and may benefit from professional consultation. Let's briefly discuss the Canadian 24-hour movement guidelines. With regards to physical activity, it's recommended to accumulate at least 150 minutes per week of aerobic activities. These guidelines also recommend reducing sedentary time, breaking up prolonged sitting with short activity breaks, focusing on optimal sleep of 7 to 9 hours, and maintaining consistent bed and wake times. Lack of sleep may increase risk of falls. We will now discuss compelling research on the different types of exercises for falls, fractures, and overall quality of life. Functional exercises that focus on movements for everyday activity and balance training. There's high-quality research to support that engaging in functional and balance training can significantly reduce the frequency of falls and the number of people who experience falls. There is also research that shows training may lower the risk of fall-related fractures while also enhancing quality of life and physical functioning in older adults. Resistance training. Research indicates that resistance training not only improves quality of life, physical functioning, and bone mineral density, but also reduces risk of death. When combined with functional and balance training in a multi-component approach, it further decreases both the frequency of falls and the number of people affected by falls. Walking, impact exercises, and resistance training alone show promise in improving physical activity and reducing mortality in older adults. However, the direct effects on fractures and falls remains uncertain. Overall, it's important to incorporate a variety of these exercises for the most benefit. We highly recommend incorporating balance exercises at least twice a week into your exercise routine to enhance stability and prevent falls. The 4 types of balance exercises include 1. Shifting body weight to the limits of stability. This can include leaning or reaching in different directions while maintaining control. 2. Reacting to things that upset your balance, like catching and throwing a ball, or reaching for an object while standing on one leg. 3. Maintaining your balance while moving. Activities like Tai Chi, heel raises, or agility training also enhance coordination and flexibility. 4. Reducing your base of support. Challenge your balance by standing on one foot or reducing your base of support. Start by holding onto a stable surface for support and progress to standing independently. Remember, consistency is key, so aim to incorporate these exercises into your routine regularly to see improvements in your balance. Now on to functional exercises that are recommended at least twice weekly. These are movements that help improve our ability to perform daily activities with ease and even enjoy recreational activities. One excellent functional exercise is chair stands, which helps strengthen the muscle in your legs and core, which are essential for activities like getting up from a chair or lifting objects from the ground. To do chair stands, simply stand up from a seated position without using your hands and then sit back down slowly. Repeat this movement several times to build strength and endurance. Another is stair climbing, which is a great way to build up cardiovascular fitness and leg strength. It also mimics activities like hiking or walking uphill, which are great for maintaining mobility and independence. It's important to start slowly and gradually increase the intensity as your strength improves. Resistance training involves exercises that challenge your muscles. There are 6 different categories of resistance exercises that range from beginner to hard. We will share beginner exercises that can be progressed slowly. 1. Push exercises. Start with wall push-ups. 2. Pull exercises. Start with elastic band rows. 3. Squat exercises. Start with sit to stand movements. 4. Hinge exercises. Start with a hip hinge. 5. Carry exercises. Start with carrying a similar low weight, such as 1 to 3 kilograms, in both hands and increasing gradually. 6. Reach or press exercises. Start with an elastic band press. When performing resistance exercises, it's important to start at a level that matches your current fitness and gradually progressing as you become stronger. Focus on proper form and technique to maximize the benefits and reduce your risk of injury. Further details can be provided in the resources at the end of this presentation. Other activities are also encouraged, but may need to be modified for safety. Below are just a few examples. First, yoga and Pilates. These exercises focus on flexibility, balance, and core strength. Yoga exercises that involve bending or twisting of the spine should be modified for people at high risk of fractures. Walking is a fantastic low-impact exercise that promotes cardiovascular health and overall fitness. Make sure to choose safe walking routes and wear appropriate footwear. Impact exercise. Activities like dancing or jumping exercises can improve bone density and cardiovascular fitness. Start with low-impact variations and progress cautiously. These activities should complement, not replace, essential activities like balance, functional, and resistance training. The key is to prioritize activities that you enjoy and can perform safely. We would like you to be mindful of the following good practice statements. 1. Exercise modifications. Activities that involve rapid, repetitive, sustained, weighted, or end range of motion twisting or flexion of the spine may need to be modified. This is crucial to prevent potential injury. Seeking professional advice. When available, it's recommended to seek advice from exercise professionals who have specific training on osteoporosis, such as BoneFit professionals. These professionals can provide guidance on exercise selection, intensity, progression, and modification, especially important after a recent fracture or if there's a high risk of a fracture. To find more information on exercises that may help with managing your osteoporosis, we've listed the following resources: Osteoporosis Canada, Too Fit to Fracture handouts and videos, which detail exercise recommendations tailored for individuals with osteoporosis. Next, the BoneFit website, which provides information on where patients can find exercise and fitness professionals. And lastly, the Ontario Osteoporosis Strategy, which provides exercise recommendations for preventing falls and fractures in older adults. In conclusion, prioritizing safe exercise is essential for maintaining bone health and reducing the risk of fractures, especially as we age. Incorporating a comprehensive routine that includes balance, functional, and resistance training exercises at least twice per week can significantly reduce the risk of fractures and enhance overall physical well-being. Remember, Consistency is key to reaping the benefits of exercise and preventing osteoporosis-related complications.